Our special guest is on, Richard Peoples. Richard, thanks for joining. A little bit about me. I'm not going to go into these details, but I've been doing this a long time. I've seen thousands of pitches in the last 20 years of working in dentistry, and prior to that in and just technology in general. The main focus today is working with these startups, getting the pitches going. If there's time at the end, we'll open it up to additional pitches. A little bit about us. We're an advisory service. We are not a dental venture capital firm. Prior years ago, I worked for a dental venture capital firm, and one of the things that I found was that, one of the underserved markets is really the startup companies. Venture capital invests in only 1% or less of the companies that they see. And because of that, there's 99% plus startups out there that need some help. And, most of them are broke, as I was when I put $1 million of my own money into some of my businesses. And my heart is there, but we do have some people that we have to pay. So there is a small fee to be a part of the program. But you can learn more about that at dentalvc.org. This is a little bit more about our process.
Thank you, Travis. Exciting to present to you. We're going to start this off interactively. The question here we're going to propose to you is, what are your biggest challenges in scaling your dental business to reach a wider audience?
All right, I'm going to end the poll and show the results. It means they're going to be great advisors for all these startups that are pitching today.
The purpose of this presentation is to address user acquisition, sales, marketing, the silos, the disconnected systems. And the reason why we come to a position where we can become aware of problems has a lot to do with auditing, right? Google Analytics 4, making sure we're tracking all devices, every single session, putting a dollar amount or a value amount to any time someone books a demo. Google Ads conversion or conversations. As you know, we need to follow up within minutes. Let me say that one more time. If you have budget constraint, it's a free tool. Most of these efforts are placed into the scale phase of things. It takes about 90 days to really know and have some predictability. But after those 90 days, we can obviously do things like identify your cost, your customer acquisition cost. These are all 3 KPIs that investors want to see before they pull out their checkbooks. We want to be able to centralize everything into an elegant, unified solution. So if you want to, say, inquire or you want to explore the suite of solutions, if you head on out to our website and you click on the CRM, you can get access to there.
Biggest problem in the dental market, turnover rates and a staffing issue, and that translates to anywhere between 100 to 200 all the way up to 500 calls. That already tells you that it's a big issue. So what we've built is basically a voice AI receptionist that's able to take all the inbound calls, talks to the patients just like a human does. Got, as I said, integrations with most of the major PMSs that practices use, like Dentrix, Open Dental, EagleSoft, all of them. And basically 3 billion of that, and then the obtainable market for us would be somewhere in the vicinity of 300 million. Basically, Arini AI, Dentina AI, Ronda AI, if you know any of them. But here you can see that's basically what we do. The integrations, and we've got 13 customers so far, a couple of group practices that we are working with. And these are our pricings, starts at $599, $799, and $899. It's got different things. So we place ourselves in between the receptionist and the voicemail, and the calls are about to go missed. We jump in and we take it. And basically, we are looking to acquire customers for sure.
I'm Joe Guster, CEO of DentalFlow, where we help dental practices be more productive with our productivity-focused platform of analytics and patient self-scheduling. Provider pain points vary, but all point to one problem. My business is not profitable. The attention that it needs, so it's underperforming. At a DSO, profits are lost in inefficient workflows across all the locations. That's where DentalFlow comes in to provide dental professionals the tools they need to be more productive. We're able to fill the schedule with profitable appointments, as well as provide key insights for the practice to become more efficient. Our patient self-scheduling features allow the practice to be able to book appointments 24/7. Whether you're understaffed and missing calls throughout the day or onboarding a new associate, DentalFlow can help fill the schedule for you. We built the DentalFlow scheduling solution to make it easy for new or existing patients to schedule an appointment without interacting with the staff. And then on the flip side, we also interviewed some providers as well, and also found out that 75% of practices had not even considered offering a patient self-scheduling option.
The goal of ethics is to help solve complex regulatory compliance and compliance issues of the environment of dental practices. I think one of the things we see is the inability to meet timely compliance and reporting requirements. And this certainly can create legal exposures and increased costs for non-compliance. And I think probably the number one problem that we're actually seeing, and maybe I should have put this first, was poor worker engagement. What do? We simplify compliance with a single comprehensive software platform with robust tools for compliance dealing with environmental, worker safety, and risk management. Dental practice management software is growing at a very accelerated rate, at least 11 to 12% annually, with an expectation to reach $7.5 billion by 2030. We're getting excellent traction. We have over 210 locations, 1,800 users, and we're moving our pilot users to paid monthly subscription. We really want to have an enjoyable user experience.
I'm Dr. Mark Thorson, retired general dentist, dental educator, dental innovator, and dental sales professional. Who's had a filling recently? Was it fun? Dental patients want three things. Please do a great job. Please do it very efficiently. And please, please don't hurt me. The average clinician requires between 60 and 75 seconds to place this hardware. The whole point is to keep the little bands in place so the filling stays and keeps its shape. What's the solution? The solution is Inflatrix. Comfort is extremely important now because lasers are gaining a significant traction in use in cutting teeth and putting fillings. And the vast majority of laser applications do not need shots. Inflatrix is being evaluated by top key opinion leaders, where the FDA says we are a 510(k) exempt device. We are the team to do this. Our ask is $300,000. Inflatrix will save time, money, and build trust. Again, thank you for your time. Please join me. I look forward to talking to you.
So my name is Shazia. I am the founder of OCare AI. Our aim is to reduce the rates of oral disease worldwide. And the tool that we're using to do that is imaging. But how do we change our dental practices so that we can be more proactive as opposed to reactive? Photography is an amazing resource, and we can capture the tissue, the texture, the patterns, and couple that with artificial intelligence. So what we have done at OCare AI is develop this platform. They can actually take action there and then to clean away anything that may develop to something more extreme in the future. Clinics can actually increase their revenue by up to $7,800 a month if they use photography on a more regular basis. And so if you show your patient a photograph as well as the treatment you're offering, they're more likely to accept it. The dental talent actually comes from our advisors, Professor Michael Gogaier, who's the head of dental oncology at UHN, one of the largest hospitals here in Toronto, and John Tran, who's a dentist out of Calgary. My email is shazia@ocareai.com, and I would love to sit down and have a chat with you. Thank you.
We are Om Biome, and we make algae botanicals for the mouth and gut. I'm Dr. Julia Paraderi. Really, I'm on a mission to help the body heal itself with nature's most powerful ancient microorganisms. 50% of the people over age 35 have starting to have problems, and we're focusing on problems like bleeding gums, deep periodontal pockets, mouth sores. We're seeing chronic exposure to toxic ingredients, especially in oral hygiene products. Algae are ancient microorganisms. They are known to have a rich nutrient profile, accelerate tissue repair, really to help the body heal. But we are the first to use whole spirulina for topical applications. We have two products on the market. First product is a tooth powder. Our next gen product are spirulina chewables. You know, nature has all the answers, and all we're doing is harnessing it and bringing it to people that need it. So from gums to bums, and you can imagine the total available market. We are right along with those, and of course we're much better because we're spirulina first, whole spirulina, and all. Our ask is 1.3 million. So thank you so much.
I'm Fernando Volante. I'm the co-founder and CEO of OraTray. Today, I'm thrilled to introduce you to what we believe is a product that will transform the delivery method in the dental industry. Dental caries and periodontal diseases are two of the leading threats of oral health. With OraTray, we aim to prevent and treat these conditions effectively, all while making the process much simpler and less costly. There hasn't been a significant innovation in the delivery method in dental treatments in over 30 years. The dental fluoride treatment market is valued at 11 billion today, and is projected to grow to 15 billion by 2027. We want to capture the 3% of this market, which translates to 1.8 million patients a year. Current methods are uncomfortable, wasteful, and not suitable for our at-home use.
So I'm Wes Reed. I'm the founder of a outsourced CFO firm called Practice CFO. We are financial planners and investment advisors as well. So it's a comprehensive personal and business CFO. And we have about 400 dentists that we work with nationwide, been involved in hundreds of practice sales, dental transitions. And so it's very who you know, who's got the biggest Rolodex, and dentists really don't have the best experience in that. What I'm wanting to do is introduce a technology. It's called Practice Orbit. Practice Orbit is a multi-sided platform. I have put about $700,000 of my own money into this, and about 3 years of my time. I have a stateside development team. The development is very, very good.
I'm James DeLuca and developed the proprietary process where we can analyze a dental practice and figure out roughly how much opportunity is in that practice in basically inefficiencies. What our DNA is, as far as a mission, we're here to help dental professionals unlock those hidden revenue opportunities and optimize practice efficiency through data-driven methodologies. The three main problems that we address is one is the management by intuition, which we really solve through our data process. We're capturing right now about $400,000 in additional annually recurring revenue. Our marketing strategy covers 4 areas for right now. So basically, the ask at this point is our scalability is being limited right now at this point from the lack of technology. We expect to move into 10 million plus annually. So we're looking for ultimately investors or partners that could help make the technology aspect happen for us.
My name is Dr. Kamir Patel. I'm the CEO and co-founder of SmartChair.ai, and I want everybody to look around and see if they have any smart devices or smart watches that they can look at. As we have seen the evolution of the regular watch becoming an Apple Watch because become synonymous with the regular watches, now technology has been able to take it one step forward to becoming even more smart, like using AI with Whoop, where they can automatically understand the type of activities that you're doing. In a day and age where we monitor our sleep to the last minute, we monitor our food intake to the last calorie, why are we not monitoring the biggest capital asset in the dental office? That's the dental chair. And we see a market opportunity where even capturing 5% of the 600,000 dental chairs in the US, we can end up with 18 million in annual recurring revenue. Our current ask is $1 million, which we have broken down into 2 tranches of 500K each. Our website is www.smartchair.ai. Thank you.
My name is Ralph George, and Smilefy is the platform that empowers dentists with AI-based technology, diagnostics, and an aesthetic treatment plan. My goal is to revolutionize smile design by introducing a groundbreaking platform that centers around the treatment plan options. The platform will automatically adapt the 3D design based on these decisions, streamlining and automating time-consuming procedures and workflows using AI technology. What we address is a problem on the market. The problem on the market is the limited treatment control for dentists. That's why Smilefy is a shared side solution, AI power efficiency, treatment plan quality, higher case acceptance rate, and improved patient care, because that's what we need. On the chair side, we are pretty alone in this area on this market. We do have a huge market potential. It's 1.1 billion. Our valuation is 20 million. And the 20 million is based on the exit proposal that we had actually 2 years ago.
We're looking to provide a really revolutionary solution that's non-invasive, easy to use, and significantly increases bioavailability and delivery to the cells and organs of the body. ROA is our route of administration. So what we've done is we have a strong international patent, and it's based on the idea of, right at the moment, we're working on functional chewing gum. We're looking to go upstream to the source of disease, which is a lot of the pathogens that are in the mouth. This is our B2B sales channel. This is our team, our brains people here, myself. We have a polymer scientist, and let me go. That's $1 million worth of value in manufacturing. and we're looking to raise $4 million.
I am a chief revenue officer for a number of different dental companies. And today what I'd like to do is I would like to share with you export occlusal mouth guards. Now, it's basically because mouth guards have not had any great changes to the technology in over 60 years. They don't feel protected. They don't feel good in the mouth. They can't speak with it in. They're uncomfortable and they don't work. We have the only triple layer, 3-dimensional, custom fit carbon fiber mouth guard on the market, which gives us protection, comfort, communication, and performance. Protection. Carbon fiber, it's one of the strongest materials in the world. It is lightweight and not flexible at all. This is a $4 billion market with a crummy 5.8% CAGR. Well, we plan on disrupting that. We are asking for $300,000 for 6% of the company.
I am the Chief Business Officer of Oral BioLife. I'm extremely excited to talk to you guys today about AmberLux Dental Gel, which we are developing to optimize bone regrowth and dental care for not just humans, but animals too. So we are aiming to revolutionize dental care with pioneering bioactive technology, starting with game-changing treatment in periodontal disease. When I say the elephant in the room, I mean for dental, of course. It affects half of adults globally, which is 65 million in the US. So enter AmberLux Dental Gel. We are developing a gel that is pretty simple. How does it work? There's something called the piezoelectric effect. You can see how beautiful that bone regrew, and our scientists were just giddy. The reason I'm excited about this from an investment standpoint, there's threefold profit potential. So it would be a potential acquirer right there from our dental health, starting with periodontal, and if successful, we can even go on into long bones and orthopedic. It has the potential to be a $1 billion company in revenues. So the ask is $1.3 million, and thank you.